Hello everyone!
Welcome to the lecture series, a partnership between LAOHA
and LATAM GTC.
I'm Zilson from clinical team and LAOHA member.
And I'm Fernanda. I'm part of the LATAM GTC team.
Fernanda, we're beginning this series of videos to share these advanced topics. What do you think?
Zilson, I think it's a great opportunity. I'm so proud of that. And we do hope everyone enjoys these presentations.
A group of renowned professors will talk you through different oral conditions, which range from caries to periodontitis.
Let's start.
Today, we will talk about an oral health condition that bothers a lot of people in the world, the dentin hypersensitivity.
Hypersensitivity is a chronic disease, and there are evidences in the literature that millions of people suffer with that.
So, let's learn a little bit more on that. Today, we'll talk about dentin hypersensitivity. For that, we invited Dr. Cassiano Rösing from Brazil. He's a member of LATAM Dental Health Unit and participated during the Pro-Argin technology in LATAM.
Dr. Cassiano Rösing has a master's and doctoral degree at University of São Paulo. He is a professor of periodontology at Federal University of Rio Grande do Sul, visitor researcher at Oslo University, and holds a productivity grant for research from the National Research Council in Brazil. Welcome, Professor.
Thank you very much.
So let's begin. On to you, Dr. Cassiano.
Okay, thank you.
Hello. Today we are going to talk about contemporary strategies for dentin hypersensitivity management. I'm very happy to be here in this activity, which is hosted by Colgate-Palmolive, and I am a consultant and researcher of Colgate, and I also do research for other companies. But actually, the fact that makes me happy to be doing this conference here is the fact that I was being part of the development process in the Pro-Argin technology in Colgate-Palmolive before the launch. A group of researchers from around the world were invited to take a look at the literature and help Colgate in designing new research projects before the launching of the Colgate-Palmolive technology, which was called Pro-Argin, with the use of arginine and calcium carbonate. And actually, this is very important because dentin hypersensitivity is a painful, short, exaggerated response triggered when exposed dentin is subjected to thermal, to mechanical, or to chemical stimuli. But in fact, what needs to be kept in mind is that dentin hypersensitivity is a pain. And a pain is always very, very, very impacting to people. And I would like to refer to what the impact of pain is with this painting by Frida Kahlo, a Mexican painter, which broke her column. And Frida Kahlo is showing herself here with tears in the eyes, demonstrating the pain that she was feeling, but she was also demonstrating her nudity. And her nudity expresses that she can do very little about this pain that she has. And also you can see nails in several parts of her body, and these nails mean that this pain that she is feeling is really hurting all herself. And actually, dentin hypersensitivity is considered today one of the chronic pains of the body of the organisms. This means that, for example, hypersensitivity can be compared to migraine. Hypersensitivity can be compared to the pain that we have from arthritis. And all these situations give the impact of what a chronic pain means and how it impairs quality of life of individuals. And this is extremely important, but for that we need to understand about a little bit more about how big or how impacting disease, looking to the epidemiology and pathogenesis of dentin hypersensitivity. For example, studies around the world have shown different prevalences of dentin hypersensitivity. This pool of studies here in London, actually in Great Britain as a whole, demonstrate prevalence of 4 to 74% of individuals with dentin hypersensitivity. In the United States, it's estimated that 18 to 30% of the people can experience chronic dentin hypersensitivity. For example, data from Japan demonstrate a prevalence of 16, data from France of 14, and from Germany 13% of the individuals with dentin hypersensitivity. And we have data from Brazil, from our group of researchers, in which we did a representative sample study demonstrating that dentin hypersensitivity has a prevalence of 33.4% when you use the air blast and 34.2% when you use a tactile stimulus. And this, when we make an analytic approach, what we can see is that if you look at this table, females, they have twice as much chance of having hypersensitivity than as compared to males. And the individuals in the 35 to 49 years of age, they also experience much more hypersensitivity than individuals over 60. Heavy smokers and the ones who experienced periodontal therapy, they are also in higher chances of experiencing dentin hypersensitivity. A count that was made, an estimation that was made some years ago, can demonstrate that there are more than 10 million patients in the world that present chronic dentin hypersensitivity. This is a lot of individuals. And this means that more or less, and of course this is an approximation, more or less 1 in every 4 individuals has dentin hypersensitivity. And this is really an impacting problem, and this goes exactly in line with the representative study. So even though we have a range of prevalences, it is well known that approximately, or at least, not approximate, but at least 1 in every 4 individuals will experience some kind of chronic dentin hypersensitivity. The reasons for this variability in the data is that we have different studied populations. Not all of them are studies with representative samples, and there's a lot of different diagnostic tools, including self-reported and clinical examination, for example. But what is known from the majority of these studies is that women or females, they present more hypersensitivity than men, that the peak age is between 30 and 40 years of age, and the pain mechanism is that related to the fact that if you have exposed dentin, you are going to have a possibility of having dentin hypersensitivity. If we look at this microscopy pictures here, we're going to see that there are spaces in which, in the teeth, in which the cementum and the enamel are not close together. So we have a gap between the cementum and the enamel, and this goes for approximately 5 to 10% of the situations. And this is the fact that leads to dentin hypersensitivity. But even though if you have the enamel and the cementum in the same position, this amount of cementum is very thin, and if you have a very thin amount of cementum, it can be removed very easily with brushing, for example. So different mechanisms have been studied about the possibility of understanding how does this pain occurs. And we have the odontoblastic transduction theory, the modulation therapy, the gate control therapy, but the only one theory that has become more based in sound science is the so-called hydrodynamic theory. The hydrodynamic theory was was a hypothesis that was proposed by a dentist called Martin Brännström from Sweden. And Martin Brännström posed the fact that if you have the tooth surface here, and the dentin is exposed to the oral environment, this is going to be a place to receive stimulus from acids, from different temperatures, from tactile instruments. And inside the dentin tubules, there is a fluid. And this fluid is around the nerval ends. And what happens is that when there is a stimulus in the outside, in the outer part of the dentin, there is going to be a very little movement of this fluid, and the movement of this fluid is going to trigger a response into the hypothalamus. And this is the theory that demonstrates the fact that limiting the movement of this fluid would be a good way of treating dentin hypersensitivity. Studies that have been performed in extracted teeth demonstrate that in teeth that had hypersensitivity, there would be much more units of dentin tubules per area. So this means that there is a greater amount of exposed tubules in teeth with dentin hypersensitivity. In the same line, the diameter of the teeth with hypersensitivity is twice as much higher as the diameter in the teeth without tooth hypersensitivity. But this happens because several of predisposing factors. And these predisposing factors include gingival recession, the presence of acids, the quality of biofilm control, and periodontal therapy, for example. So we know that when we have gingival recession, in the area where the dentin is exposed, the tubules are open there, and this can lead to the fact that the stimulus can achieve the area to have the movement of the fluid. This is the first and foremost more important predisposing factor, which is gingival recession. Also, the biofilm control is of extreme importance because, for example, we can see a very inflamed gingiva, which means the patient is not doing a good biofilm control. When we have this, we will have a possibility of inflammatory mediators circulating the body, and this leads to more tooth hypersensitivity. On the other hand, an extremely good biofilm control will also lead to hypersensitivity, since it will lead to gingival recession, and also not only the fact that gingival recession occurs, you're going to have the removal of cement of tooth tissue, which is sound. So therefore, the recommendation is, of course, that we do adequate toothbrushing. And adequate toothbrushing means not to use long movements and not to use excessive force. And also it means that you have good toothbrushes with the stiffness of the bristles and the form of the bristles with important situations, which is first, the stiffness of the bristles needs to be mild, needs to be very, very soft. And the form of the bristle needs to be normally with a rounded and soft possibility, so that it won't damage the tissues. The bristles need to be round, so they are not going to damage the tissues. And when you have irregular bristles, you could have an aggressive component, and this could lead to dentin hypersensitivity. And for more importance is the presence of acids, and the presence of acids which will enlarge the diameter of the dental tubules is of extreme importance. So we're going to see in a further section, when we talk about diagnosis, we're going to see the importance of knowing how does the individual has his eating and drinking habits related especially to acids. So actually the pathogenesis of dentin hypersensitivity is related to the exposure of the dentin and to the enlargement of the tubules, and for example the presence of the constant presence of acids. So with that in mind, this makes a summary of what is the pathogenesis of dentin hypersensitivity, and I would be very delighted if any one of you would have any questions that could be raised, so that I can prayerfully answer it. Thank you.
Thanks, Cassiano. We received a question from India GTC, so let's see it.
Hello, I am Leena Natarajan from India GTC, and my question is sensitivity truly reversible? And if sensitivity is reversible using a toothpaste, can it reoccur?
Thank you, Lina, for your very important question. And in fact, really, dentin hypersensitivity is a truly reversible condition. And it's a truly reversible condition with the use of the toothpaste, with the use of the dentifrice, in the fact that we have clinical data supporting that the reduction in tactile stimulus, dentin hypersensitivity, and air blast is reduced for at least a period of 2 to 3 months. And the question about reoccurrence of it is real if the individual stops using it during a period of time which is not that long from the start of it, it can reoccur. But actually, if the patient is hypersensitive, so he has hypersensitivity for a long time, and it heals for a long time as well, it might not reoccur again because time has passed by and the dentin is constructing more and more tissue, taking the stimulus longer or in a more distant part from the pulp. So actually it is reversible, and if you don't continue to use it, it can reoccur, but it will heal again. But after a long period of time without that hypersensitivity, you probably won't have it anymore.
Thanks, Cassiano. Click for the second block. Don't miss it.